Hello, and welcome to the Pause Study DOAC Interruption Practice Scenario and Frequently Asked Questions video. Over the next few minutes, we will be reviewing different DOAC interruption scenarios and answering some frequently asked questions. Please be reminded of our interruption protocol flow diagram seen here. If you have a copy, please keep it beside you to help with the following scenarios. Please be reminded that this video can be paused at any time if you need more time to figure out how many days of DOAC a patient should skip. Scenario 1. A patient taking Pradaxa is having a low-risk surgery on Friday morning at 8 a.m. Their creatinine clearance value is 48 mL per minute. How many days of DOAC should this patient skip? 2 days of DOAC. When should the patient's last dose of Pradaxa be? On Tuesday night. Scenario 2. A patient taking Xarelto is having a low-risk surgery on Tuesday at noon. Their creatinine clearance value is found to be 72 mL per minute. How many days of DOAC should this patient skip? That's right, 1 day. When should the patient's last dose of Xarelto be? On Sunday, whenever they normally take it. Scenario 3. A patient taking Pradaxa is having a high-risk surgery on Tuesday morning at 8 a.m. Their creatinine clearance value is 44 mL per minute. How many days of DOAC should this patient skip? 4 days of DOAC. When should the patient's last dose of Pradaxa be? On Thursday night, the week before surgery. Scenario 4. A patient taking Eliquis is having a high-risk surgery on Wednesday at 2 p.m. Their creatinine clearance value is found to be 50 mL per minute. How many days of DOAC should this patient skip? 2 days. When should their last dose of Eliquis be? On Sunday night. Fifth and final scenario. A patient taking Pradaxa is having a low-risk surgery on Friday morning at 9 a.m. Their creatinine clearance is 95 mL per minute. How many days of DOAC should this patient skip? Just 1 day of DOAC. When should the patient's last dose of Pradaxa be? On Wednesday night before surgery. Moving on to frequently asked questions. What if the patient went on their DOAC 2 weeks ago? Don't worry, this patient is still eligible because they have had ample time to follow the interruption protocol. What if the patient is having a procedure outside the hospital and I know this before consenting, and I also know that I won't be able to get a blood sample? Can I still enroll the patient? No, you cannot enroll the patient if you are unable to get the blood or if the patient is not willing to give their blood. If, on the surgery day, blood is missed for some unforeseen reason, this is okay, and the patient may remain in the study. What if the physician or surgeon says it's a high-risk surgery, but the guide says it's a low risk? The guide is a guide only. Ultimately, the risk for bleed is up to the preoperative MD. Remember that this MD must also be willing to follow the interruption protocol for the risk that they assess. What if the physician agrees on the surgery risk, but doesn't agree to the interruption protocol? Let's say the physician wants to stop DOAC for 3 days instead of 2 days before surgery. This patient is discontinued because the patient and physician are unable to follow the interruption protocol. What if the patient's surgery is canceled and rescheduled to a known date? This is a long one. You must verbally consent with the patient that they will continue and they will have another surgery. And then you can keep them in the study with the same ID. When they have their future surgery, enter the actual date of surgery in the surgery visit and the actual date of DOAC interruption, and click No to the question, was the actual surgery date the same date as the planned surgery date? Because it was not. Follow up for 4 weeks from the date of surgery just like usual, so you'll have week 1, week 2, week 3, week 4. If blood was collected for the canceled surgery, keep it if possible, and enter it into the database called Enter Data for Blood Collected from Patient Whose Surgery Was Canceled. Please collect a new blood sample on the date of actual surgery and enter this into REDCap on the surgery form. What if the patient's surgery is canceled on the day of surgery permanently? Since this patient presumably interrupted their DOAC before surgery as they were told, this patient remains in the study for follow-up. Please follow up with them like usual on weeks 1 through 4. What if the patient's surgery is canceled before they were told to stop their DOAC and it's never been rescheduled? Since this patient did not interrupt their DOAC, they are discontinued. No follow-ups are necessary, and you can discontinue the patient in REDCap. What if it's a low bleed risk, and that was assessed before surgery, but during surgery there were complications and it became a high risk? Do I change the risk on the screening form and on the CRFs? No, please don't change the risk. The pre-op risk for bleed assessment will stay the same, but there may be a change in restart based on this new risk assessment. What if I can't get the blood sample before surgery? That's okay with us. Please get the blood sample right after surgery. What if I can't get a hold of the patient on day 7 post-op? This is also okay. If a patient cannot be reached on day 7, try on days 8, 9, or 10. If a patient cannot be reached on day 10, wait until day 14 and try again to ask them about the previous 2 weeks. In this way, some follow-ups may be conducted on the same day. We are really trying to avoid to have patients lost to follow-up, so please keep trying. This concludes our video on the PostOp interruption practice scenarios and frequently asked questions. Please take a look at some of our other PAUSE videos, including protocol review and an introduction to REDCap. Thanks so much for watching.